With the recent increase in the viral respiratory illnesses, local hospitals are also looking to increase the number of patients and visitors who wear masks.
And while these changes in masking policies aren't as severe as those enforced during the pandemic, they are becoming more and more common. Tonight, we speak with a local pair of doctors about why masking up is becoming the go-to method for hospitals trying to keep down their rates of infection. An uptick in viral respiratory illnesses has prompted Baystate Health, Mercy Medical Center, and Cooley Dickinson Hospital to tighten up their masking policies. None, though, issuing a comprehensive and complete mask mandate like what we all experienced during the pandemic, but mask wearing by everyone is still strongly recommended.
We know from research that masks do decrease transmission of viral diseases.
Dr. Levin says most viral diseases are spread in the same ways: direct contact like a doorknob, large droplets from coughing and sneezing, and through the air by attaching to small water particles. It's those latter two methods that masks help to prevent, effectively slowing, if not preventing, the transmission of viruses now making the rounds: flu, RSV, and COVID. And while all masks aren't created equal, even the basic ones, the ones that most of us wear, can help, as Dr. Asha Demija from Mercy Medical Center explains.
Cloth mask or the regular mask that you're talking, it generally offers some kind of protection, but it is lower levels of protection that it offers compared to the surgical or the disposable masks that we use in the hospitals.
But any mask affords some type of protection.
100%. Any mask will offer some kind of protection.
Especially for those who have compromised immune systems and other underlying health issues. Precisely the type of people you find in hospital settings. As of now, Mercy Medical Center strongly recommends employees, patients, and visitors wear a mask at hospitals and ambulatory locations. Meanwhile, Baystate Health telling Western Mass News they require masks in direct patient care settings. Visitors older than 5 in patient rooms will also be required to wear a mask. And masking at Baystate Health medical offices is recommended but not currently required. A similar policy for Cooley Dickinson, with staff mandated to wear masks during direct interactions with patients throughout most of the hospital, except in lobbies and other common areas. Patients and visitors strongly encouraged but not required. It's a trend Dr. Levin says we should be getting used to, because just like the viruses they're trying to contain, masking policies aren't going away anytime soon.
I do think this is the new normal. It's not only hospitals, but individuals who now, because of the pandemic, have a greater awareness of illness and transmission of illness.
The current hospital mask policies aren't permanent. Changes are continually being made throughout the year as healthcare systems update them depending on existing conditions.